So hi everyone, this is a very important video for all the residents who work in ICU. In this video, we are going to learn about important corticosteroids used in ICU. We won't be going in very detail like understanding the mechanism of action and all, because this is not a pharmacology lecture, but we will try to understand the indications of these corticosteroids in ICU. Like we will try to understand in which all conditions you should give hydrocortisone, in which condition you should prefer methylprednisolone, and when to prefer dexamethasone. So basically in this video we are going to cover the intravenous steroids that we use in ICU. Okay, I have made a separate video on oral steroid like prednisolone. I will give the link of that video in the description and also in the I button. So now let us give 1 minute to revise the normal physiology of our body and trying to understand where all these corticosteroids come from. So on the top of the kidneys we have adrenal gland. The adrenal gland consists of cortex and medulla. The medulla makes epinephrine and non-epinephrine, which we hardly care about in this video. And the cortex consists of three layers, which we all are aware of. The famous mnemonics is GFR. It consists of zona glomerulosa, zona fasciculata, and zona reticularis. The zona glomerulosa makes mineralocorticoids, the zona fasciculata makes glucocorticoids, and zona reticularis makes sex steroids. So for the sake of this video, our prime focus is going to be on mineralocorticoids and glucocorticoids. Look, all these corticosteroids are synthesized in our body, but there are certain conditions in which we are forced to use the artificial or synthetic form of these steroids for the benefit of patient, and that is what we are going to learn today. We will be able to understand the indications of these corticosteroids better if we are aware what is the function of mineralocorticoid and glucocorticoid in our body. Look, mineralocorticoid, that is aldosterone, helps in sodium and water retention. At the same time it excretes potassium. So basically the mineral in this word suggests that it has to do something with the important minerals in our body. On the other hand, glucocorticoids is an anti-inflammatory corticosteroid. It increases in stressful condition and helps body to fight against the stress, and also it has got anti-inflammatory action. So now let us try to learn the exogenously administered corticosteroid. This corticosteroid can again be divided into the two same types, that is mineralocorticoids and glucocorticoids. And the glucocorticoid is again divided into three major types based on their duration of action. The first one is short acting, which has action of around 1 to 12 hours. An example under this is hydrocortisone. The other one is intermediate acting, which got duration of action of 12 to 36 hours, and the example of this is methylprednisolone. And the last one is long acting, which has got duration of action of 36 to 55 hours, and the example for this is dexamethasone. We are only considering the important IV drugs that are used in ICU, because if we try to talk about the other drugs, for example in the intermediate group there are other drugs like prednisolone, triamcinolone, and deflazacort, and in long acting there is beclomethasone. Talking about mineralocorticoids, there is a single drug known as fludrocortisone, which we are going to study today. So let's start with hydrocortisone, as we are now aware that it is a short acting glucocorticoid and it has got duration of action of 1 to 12 hours. Look, whenever we study a corticosteroid, we have to look at two aspects, that is its glucocorticoid potency and its mineralocorticoid potency. And hydrocortisone is a such drug that it has got equal glucocorticoid as well as mineralocorticoid potency, and that's why whenever we read about other drugs, we always compare the potency of other drugs with that of hydrocortisone. Okay, so hydrocortisone is going to have a effect on sodium and water retention, and at the same time it is going to be anti-inflammatory to a certain extent. We will discuss the indications at last for better understanding. Now the second drug is methylprednisolone. It has got duration action of 12 to 36 hours. Methylprednisolone, as compared to hydrocortisone, it has got half of its mineralocorticoid potency, and when we talk about the glucocorticoid potency, it has got 5 times more to that of hydrocortisone. So we can say that it is going to retain less sodium and water compared to hydrocortisone, but is going to show a good anti-inflammatory action when compared to hydrocortisone. The third one is dexamethasone, which is a long-acting corticosteroid. It has got duration of action of 36 to 55 hours, and it has 25 times more glucocorticoid potency as compared to hydrocortisone, and at the same time it has zero mineralocorticoid action. So we will be using this dexamethasone in certain conditions where we need a very strong anti-inflammatory action, like in cases of cerebral edema, where we need a very strong drug to decrease this edema, because this can be life-threatening to the patient. Similarly, whenever in the post-extubation state, whenever there is laryngeal edema or stridor, in such condition we need a strong anti-inflammatory drug to decrease that edema. So in such condition also we will use dexamethasone. So now let's talk about hydrocortisone. It has got equal glucocorticoid and mineralocorticoid potency. This drug can be used in certain conditions like sepsis, where we need to maintain the mean arterial pressure, and at the same time need a drug to decrease the inflammation to certain extent. So that's why in sepsis guidelines we have hydrocortisone. The last one is methylprednisolone. Look, it has got a good anti-inflammatory action, and the mineralocorticoid potency is half to that of hydrocortisone, so it is not going to cause much sodium and water retention. So it can be easily used in certain conditions where fluid overload is a point of concern. In ICU setting, we can use methylprednisolone in certain chest infections where we need a little strong anti-inflammatory action, but at the same time it is not going to suppress the immune to that extent that sepsis worsens, and at the same time there is no concern of fluid and water retention. Now let's talk about mineralocorticoids. For example, fludrocortisone. It can also be given IV, and it is mainly used in adrenal insufficiency in case of ICU setting, where we are not able to maintain the mean arterial pressure. In such condition we use this fludrocortisone, which will help to retain the fluid and water, and at the same time it also excrete potassium, so we have to monitor that. If you want to learn about prednisolone, which is mostly given orally, I will leave the link in the description, and also in the I button you can watch it from there. And also I have made videos on SIADH, diabetes insipidus, and cerebral short resting syndrome. You can watch that from the link in the description. Okay.